Our invited speaker this morning is Professor Protasio L. He's a senior professor of cardiology at the INCOR Heart Institute at Sao Paulo in Brazil. And he'll be speaking on the the atherosclerosis prevention, drugs versus lifestyle. He'll have a time of 12 minutes, and the last 2 minutes would be for the chairman's
I'll request
comments.
Dr. Manchanda to present the token of appreciation to Daluz, coming all the way from Brazil for this most prestigious state-of-art lecture. Thank you. With this, we'll request you to start your presentation, sir.
Thank you very much. I think, ladies and gentlemen, this is the most important lecture because atherosclerosis is the biggest problem that the cardiologists face, whether it's heart attacks, strokes, or peripheral vascular disease. It is atherosclerosis. If somebody can reverse it, Doctor, we will be hearing in this lecture how we can reverse it with lifestyle, we told slightly, and with pharmacology.
Thank you very much. I wish to thank first Dr. Gupta and Dr. Chopra for inviting me to this fascinating country, which has inspired many other nations who struggle for freedom, equality, and peace. My topic today is on a discussion of the values of drugs and lifestyle in the protection of atherosclerosis. Now, statins have been the cornerstone for the treatment of atherosclerosis, and in primary prevention as well as in secondary prevention, there has been a decrease in the risk of coronary artery disease by about 30 to 35%. Although that was observed, also a residual risk remains in all the studies, and this residual risk is of about 70%, which means that there are many things to be done to actually end this risk. Now, one of the positive factors about statins is that they are the only drug that have been demonstrated to regress coronary lesions. This is the Meteor study in which was shown that patients who had LDL reduced by rosuvastatin were able to maintain a stable coronary lesions in the carotid arteries, and some of them even regressed, while the control patients had a progression of atherosclerosis in the carotid arteries, as it was mentioned before. One important data has been recently demonstrated by Dr. Packard at the American Heart Association in 2014. As you know, the WOSCOPS studies is a primary prevention study in Europe. They enrolled about 6,500 people, and they gave them pravastatin 40 milligrams a day for 5 days. Now, here's the demonstration that even after this study stopped, patients who followed the recommendation of statins had a substantial decrease in cardiac mortality after 20 years of evolution. That was also found as far as all-cause mortality. Again, this is a very impressive data. Now, the most recent development has been the creation of the Evolocumab, one of the monoclonal antibodies against PCSK9. And here is the demonstration by a study by Dr. Sabatine of the effect of these drugs in a study that lasted about a year. You see the number of patients is large here, and the reduction in the LDL values was very substantial, at about 70%. Also notice that these patients did not have a very high cholesterol level, just a moderately high cholesterol level. Not only that, but Evolocumab was associated and actually induced a reduction on the clinical manifestations of atherosclerosis. Now, we must pay attention to the fact that these are selected patients, and they received intramuscular injection in the abdomen. There were some kind effects and we actually don't know what are going to be the effects of this drug when it is being used in the worldwide real-world population. So we might wait until some more information comes on. In summary, drug therapy reduces clinical events, but only partial reduction in the risk. There is the question of intolerance and side effects, which are clinically very important. Frequently, there are need for association of medications. And then there is the problem of compliance. Many patients do not take the drug for time sufficient. And finally, there are question of the costs. Poor people cannot afford statins over a long period of time. However, cardiovascular disease is the main cause of death in underdeveloped countries, like in my own country and here too. Now, given the compelling data that I showed before, a common question from the patients is, if I take my medicines, can I eat what I want? And basically the answer is no. And here's why. This is a study done in Northern Europe. And the authors asked a very simple question. What are the effects of a proper diet? Moderate alcohol consumption, physical activity, no smoking, and the effect of all these things. You can see here a reduction of about 25%, physical activity reduced the risk by about 40%, no smoking about 40%. But notice this column here, a total reduction of 65% among those who did everything. And this everything was very, very simple. Another important study is the Lyon Diet Heart Study. They took 600 patients after myocardial infarction. And they treated half of them with an experimental diet and the other half with a so-called prudent diet of the American Heart Association. And you can see here the survival mostly important in patients without non-fatal MI and major secondary events. And to your right, the survival in patients without MI, major and minor secondary endpoints. So the diet here produced a very significant reduction in cardiovascular events post-MI. Here's also the EPIC study, an observational study from Greece, in which they follow about 22,000 people for 44 months. And they analyzed the mortality reduction in those who followed the score of the Mediterranean diet. In other words, those who followed the diet well got 2 points more, and so on. You can see here a major reduction of 25% as far as general mortality. A general reduction in cardiovascular disease of 33%, and a significant reduction also in cancer. Again, this is an observational study, but a very important one because of the large follow-up and larger number of patients. And finally, in terms of diet, there is the PREDIMED study. This was done in Spain. They enrolled about 7,500 people, 57% of them were women. They were at high risk, and their age was between 58 and 80 years. The primary endpoints were cardiovascular mortality, acute myocardial infarction, and control. And you can see here that patients in green that received a Mediterranean diet with an extra virgin oil, olive oil, and the patients that received a Mediterranean diet supplemented with diets had a 30% reduction in the main endpoints and a 28% reduction in the major endpoints, respectively. As you can see here, the control patients compared against the two treatment groups. One of the interesting findings here is that this reduction in events was not due to reduction in myocardial infarction, was due essentially to reduction in stroke. Now, To me, the most impressive data regarding the effects of diet and lifestyle is this study from Dr. Ornish. Dr. Ornish at the time was in California, and he was dealing with people who were retired. So they proposed to them to have a Mediterranean diet, prayer, counseling, and exercise. And in some of them, as you can see to your left side, he performed angiography. And here you can see the patients who follow the instructions in the open dots had a regression of the lesions of, over a period of 5 years. And the dots up here had an increase in the lesions. In other words, those who did not follow the full prescription had an increase in the lesions, and those that followed the prescription had a reduction in the degree of the coronary artery stenosis. Now, this is a small trial, but I think that as a proof of concept is really very significant. Then we are now dealing very extensively with the problem of depression. And here is a study that shows that patients who have inactivity physically and depression have a significantly higher mortality than those who have neither. And Dr. Rosansky made a very nice analysis recently, and he adopted the point of view that according to the behavior, illness can be promoted or health can be promoted. For instance, negative health behaviors, negative emotions, pessimism, sense of distress and overwhelm, loneliness, and weak sense of purpose all promote illness. On the contrary, positive health behaviors, positive emotions, optimism, successful stress management, socially connected, and a strong sense of purpose will promote health. Now, what are we specifically talking about? There are 5 items that are very significant that were mentioned before. First, non-smoking, BMI less than 25 kilograms per square meter, moderate exercise, for example, 30 minutes a day, proper diet, vegetables, fruits, fibers, polyunsaturates, fats, and fish, like you have here, and moderate consumption of alcohol. You can see the very significant decrease in the risk over a period of 16 years in a large number of men. And you can see on the extremes, few of them did nothing, few of them did everything. But in the middle, you can see that adoption of a proper lifestyle will significantly reduce the risk of cardiovascular events. In conclusion to this part, I would say healthy lifestyle is as important as drug therapy for cardiovascular prevention or even more. It should be adopted early on for children and adolescents as well, and continue for the entire life. Now, allow me not to finish before then quoting your great man, Gandhi. Talking about 7 social sins, he said, politics without principles, wealth without work, pleasure without conscience, knowledge without character, commerce without morality, science without humanity, and worship without sacrifice. We doctors and scientists are right here. Scientists, educators, and scholars. And that should be avoided at all price. So my final message for you is this. Among all human activities, religion and medicine are dedicated especially to avoid and minimize human suffering. Doctors should not only treat diseases, but conquer, understand, and protect the hearts and minds of those who suffer. Let us not forget the sacred nature of our mission. Thank you very much.
I think an outstanding lecture on the holistic system we should all practice. We doctors are forgetting that. He said statins are extremely useful, but a residual risk is there. You have to supplement with the lifestyle, and I think he covered everything extremely well. The diet, the exercise, smoking, and the most important, behavioral cardiology, which we are really not attaching too much importance. As I also showed in my studies that there can be almost 50% reduction of the risk if you use these behavior modification techniques. Thank you very much, sir, for one of the outstanding lectures.
Thank you, Dalus. I think it was a very nice presentation. The last slide was the best of him, Mr. Gandhi. The way you quoted him, everywhere, there no science is complete without a holistic approach. I think that's a very important message. Whatever data you have shown, the data can be enhanced by whatever p-values you say, whatever statistical significance. But that is very, very important. I think we really admire it. You are coming all the way from Brazil. Let's give a big hand.
Thank you.
to
Thank you very much,
for the most
Professor
outstanding
Dalus.
presentation.
Ladies and gentlemen, we'd like to thank our chair for chairing the proceedings. I'd request Dr. Chopra to kindly stay on, and he'll be joined by Professor Naveen Nanda, Colonel S.K. Parashar, Professor Dev Pehlajani, and Dr. P.N. Tiwari.